Welcome to our second Friday COVID-19 SSVA update. I'm Chip Dodd, and my co-host is Andy Plumley. We generally are just trying to give everybody in the company, sponsors, DSPs, mid-level, everybody who's involved in SSVA. I mean, honestly, the families of in-home customers are welcome to get on the call or the webinar, and we just want to give everybody an update on how things are going and changes. There's a lot going on at all levels, and so I figured a weekly update would be helpful, just because Andy and I talk like it seems like every other day, and we're chatting on 10 different platforms, whether it be Basecamp or text or WhatsApp, and they're in constant contact, and we forget sometimes that we don't have that same communication with people around the company. So we're trying to make that a little bit more open. So I'm going to try my best to stay roughly on track. I do have my notes, and we got some updates from last week. Again, I want to start and end with the same exact thing, which is we have really appreciate our DSPs that are out there working day to day in the shifts, taking the customers out, giving them the best life possible during this crisis. Again, there's like two types of workers in our society now. There's people that are kind of non-essential, hunkered down at home, and told not to leave the house unless you want to get food, drugs, meaning pharmacy, or exercise. Everybody else stay home. Non-essential travel has been banned. And then there's another type of worker called essential workers. These are people who keep our life running, whether it be hospital workers, people running gas stations, grocery stores, the nursing homes, and of course, DSPs in our field that help people with disabilities continue their life uninterrupted because of this mess. So we really appreciate all of our essential workers, and that includes sponsors that are out there having to put themselves and their families at risk by continuing to come to work. But our whole world would fall apart if these essential workers did not step up. So we just really appreciate that. I also appreciate everybody that is staying hunkered down and not going out and exposing yourself, because to date, I think we have 0 customers that have a known case, unless somebody else tells me I'm wrong, but I've not heard so far that we have a customer with it, and I've only heard that we have 1 staff person with it, and I'm pretty sure they got it from not inside the company, and to my knowledge, unless somebody corrects me, they're still doing okay. So compared to what you're seeing in the news, you guys at SSVA have done a phenomenal job in staying healthy and safe and hunkered down. We will get through this, but I'm super impressed with everybody working hard on this and treating it seriously. The other really good news that was on the VNPP call today, VNPP is Virginia Network of Private Providers, is that statewide, there's not many cases of customers getting it, according to VNPP. Not a lot of reported cases. And Jennifer's pretty in touch with Jennifer Fedora, which is our lobbyist. She's in touch with the government, and they're looking at these numbers. They're scared to death that we would have outbreaks in group homes or outbreaks in day supports or work programs. It's not happening. So we as a field are doing a really good job on treating this seriously and keeping our customers safe. And Cortez says that the staff person that did get COVID out in Lynchburg has been cleared to come back to work next week. So that is awesome news. That is just absolutely phenomenal. The last thing I want to hear is that somebody's on a ventilator and in ICU. I don't want to. I'm just hope that we all get through this without that outcome. So that's really good news. I think the governor, and I can't remember the date off the top of my head, but he did extend the shelter-in-place order. The number of cases in Virginia is continuing to increase. It's about 10% increase per day on average. So we are not expected to peak until, I believe it's the 27th. Let me do a quick screen share, just give you a update on what's happening in Virginia.
I think he extended it to the 10th of May.
Okay, that sounds right. So May 10th, and let's see, why would he do that? Well, look at this. This is, here's the Virginia hospital resource use. Let me see if I can increase the size of my screen a little bit maybe. And so what this is showing is this is the same data that the federal government is using. This is Dr. Fauci and Dr. Deborah. And so they are tracking it by state. And so, so this is pretty solid information. They're showing that right around the April 26th, 27th is the peak hospital resource utilization. So obviously that's like, 10 or 11 days away. And so we definitely need to stay hunkered down, because even at the current rate of increase of hunkered down, the hospitals are going to be very close to having a problem. I'm gonna sort this based on ICU beds, which these are the beds that have ventilators, and these are when, let's say, somebody who has COPD or a heart condition or diabetes or some other pre-existing condition, if they get COVID, it's serious, and they might need an ICU bed, versus somebody that's young and healthy and they get the sniffles and then all of a sudden it's gone. So what this is showing is that at the current rate on April 28th, we are coming very close to exceeding the number of ICU beds in Virginia. So it doesn't matter that the federal government's talking about we're opening back up the economy and everything's fine and we're going to follow Fauci's or Deborah's 3-step program. That ain't happening in Virginia. Our bubble we have not peaked yet. So this is why our governor is saying much different things than our federal government. And of course, the governor is in charge of the state, not the federal government. So I don't believe this would make sense for Northam to say the beginning of May is not enough, and we need to push it further in May to make sure we're coming down the slope on hospital bed utilization. So that's the key driving factors, making sure we do not overwhelm our hospitals. Okay. And same goes, this is the deaths per day. They are also looking at that like very late April on the down slope in May. And so that, but either way, I'll keep updating, showing you guys these charts just so that you can see why the government's saying what they're saying. This is opposed to the United States as a whole. They're basically saying April 13th, 14th, which is a few days ago, was the peak. And now in the United States as a whole, we are on the downward slope. So that's why the federal government's talking about giving states the option to begin opening up their economy. But that does not apply to Virginia, because our bubble is further to the right of this. So same with deaths per day. We've already exceeded the top number of deaths per day. We are on the down slope coming down. So just wanted to explain that real quick. I'm not sure. Let's see. Okay. So if that's the other thing, we have a chat box. We also have a Q&A box. It's probably better. It looks like people are using the chat. So let's just use one if we can. But feel free, if you have a question or you want me to clarify something, I'm happy to do that in the chat box. If you've got something that you would rather say instead of type, please raise your hand, because we can call on you and allow you to talk on the webinar and that type of thing. So just wanted to let you know that. So let's see what's next. Oh, Virginia's budget. Okay, this has been a big conversation on both the Virginia Access, which is our one trade association that's primarily workforce, and day supports, although they do have some residential providers, because many of us do both. I'm on the board of that trade association. And then VNPP, Virginia Network of Private Providers, they had their call this morning. Both are talking about the budget, because in the budget, as it sits on the governor's desk today, had a rate refresh, which effectively meant waiver services were going to get a raise, right? And I'm talking all of sponsored, in-home, group home, everything. And then COVID hit. And so that's done, if you read the paper, it's saying Virginia's got I think it's a $2 billion budget shortfall. The budget's right around 64 billion. So 2 billion relative to 64, it's a pretty big number. I have heard some other sources that are a little closer to the finance department, and it could be as much as 10 billion. 10 billion is a large portion of a 63 or 64 billion dollar budget. That's a huge cut. So whatever that is, 1/6, a little bit less, 9. So whatever, it's a lot. So I believe, even though we are pushing hard on advocacy to get waiver rates increased, to get some the day support payments going to day support providers so they can afford to pay the building rent during this crisis, because almost all days, I think they said 160 something day supports have been closed across the state. And we all got bills to pay. We've got the rent, we've got the insurance and all that. We can't not have some income. So they are trying to work on that income. But with that type of budget shortfall, I want to be in a more defensive posture, saying we are not likely to get anything new, and we are likely to take a rate cut. We need to be prepared for that at all levels, until told otherwise. But $10 billion is a lot of money when it comes down to a state budget. So that's going to be a weekly update. I'll just, whatever they say on the calls, I'll try to keep you guys up to date on what's going on with that, but it's still under discussion. It has a lot to do with the tax revenues from retail and sales and hotels and restaurants. Since all of that's shut down, the state doesn't have any revenue, and that's really the big problem. Okay, oh, one other thing that nobody's talking about, which drives me crazy, is that when the governor speaks, every once in a while he calls out a specific part of our workforce, whether it be the grocery store clerks or the nursing home staff or the hospital staff. And so I was like, where's the DSPs on the governor's call? So I've asked both trade associations, both lobbyists, to get out there and talk to the administration and tell them that this governor Northam has got to call out DSPs at all levels and thank them and appreciate them for doing what they're doing on a public stage. And so hopefully we see that come through. Watch the governor at 2 o'clock on Facebook. He goes live every day with an update. One of these days, I'm hoping that he says, thank you to our DSPs, and we will have had something to do with that. Another thing for sponsors, I'm glad we got a couple sponsors on the call. One of the bright spots in this whole craziness is that sponsor residential is a perfect place for intakes to occur and customers to get supports, because with the people in group homes coming and going, it's a little scary to do intakes. And we, of course, in Virginia Beach and Lynchburg, we have a severe staffing shortage. So we are hiring. We'll get into that in a second. But sponsored's an area that if we could bring sponsors online, sponsor residential sites online, or a sponsor needs to change addresses from point A to point B, licensing is basically shut down, and so we're not doing anything. But meanwhile, our field needs to continue moving. So I got a message from a friend of mine at a different provider that said that they're strongly considering doing virtual visits. So if we have any potential sponsors in the pipeline, we could potentially bring them online with maybe a Zoom type visit from licensing, and then we can bring that sponsored site online. Any sponsors that have a vacancy and they are interested in being considered if we got an intake, please communicate that to your divisions, or at the division level, please ask your sponsors if you know that they've got a spare bed. When a CSB calls because a customer needs to have a place to live, I want to make sure that we've got some options available. So let's just keep that communication flowing. Let's see. Okay, another really good news, almost. Let's say it's a medium good news, not a really, is the SBA loan, the Paycheck Protection Program loan that you've heard about in the press. Town Bank called me this week and said we have been approved, although I have not signed any paperwork. We haven't seen any money, but they basically said I'm approved. The PPP program did run out of money on Wednesday night, but I got my approval prior to that. So the big question in all of our minds is, did the approval guarantee that they've got enough, or if the money hadn't hit the bank yet, the money's gone, get over it, and then we got to wait for the federal government to get along and actually make a decision to add more money to that PPP program. They are arguing about it as they do over everything. So who knows, but at least the approval came through this week. I hope on next Friday's call, I can say we have been funded. In addition to already being okay, that just gives us some extra cash flow to use for very specific things like payroll and rent and utilities and healthcare, that if we needed it, we would have that backstop of cash from the SBA. So that's good news. Trying to keep it all good news, this week, I guess. Let me see. As far as I know, nobody's come to me saying we are out of PPE, even though we're not using the hospital grade PPE. But I know we have, Andrew and I delivered some masks out to Danville. I think Danville delivered some to Lynchburg. So everybody's good on masks. And I believe we have some gowns in case we needed it. But to my knowledge, nobody that wanted or needed some type of protective equipment has gone without that. So I really appreciate the team and all the divisions working together to make sure that our DSPs and our staff are protected with PPE as needed. We continue to ask anybody that works directly with a customer where you can't social distance to wear a mask, both to protect the DSP as well as to protect the customer on both ends of that. Hopefully that's occurring out in the field. Another big focus that we're going to be doing, because this is obviously going to drag on for quite a long time. It could get extended again into June. It all depends on how those curves come down. So we are continuing to focus on our training and our onboarding using virtual, right? So virtual interviews, improving the virtual training. We're talking about how do we get people to engage, because you know, there's been, all of us have had concerns, like when you're in the classroom and I'm in front of you, I can see you, I know if you're paying attention or you playing on your cell phone, and I can read your body language. It's just not the same on Zoom. You know, I can see your face here, but some people, you know, they do this and I don't want my camera on me. So I don't know what you're doing. I don't know what you're thinking. So the instructor wonders, am I getting their attention? Is this person actually learning? So we're trying to figure out ways, how can we improve our training to know that we have engagement, that the information's coming across through Zoom. So I don't know, those are some discussions, but we want to, anybody that has feedback on how we can make the digital environment as good as we can get it while we're not allowed to really be in an in-person environment. And then of course, there are, I think we narrowed it down to about 3 trainings that have an in-person component that must occur. For example, the medication certification, the CPR first aid, and the UQRU, or whatever we call it. There's some demonstration of skills that have to happen. But even in those situations, how can we do that in the safest way possible? You know, can the trainer view the skills through Zoom and a supervisor help the individual do the skills or whatever? I don't know. The safety of our staff at all levels is our highest priority. So we want the training to occur, but we want to do it in the safest way possible. So lots of discussions on that happening right now. We see, I'm burning through my thing pretty good. I'm only 18 minutes in. Yay, we gotta have time for more questions, and I won't talk as much. Please, please, please continue to encourage your sponsors and staff to get a Zoom account so that they can participate in not only these webinars on Fridays, but team meetings, trainings, even communication between the houses. Andy told me yesterday, I think, that there's Zoom is capable between the houses, so a customer could say hi to another customer. I'm really concerned. I'm sorry, let me mute my phone. I was really concerned that you know, although we have Zoom and we're able to communicate and continue operating the company, what about those customers that used to meet their friends at day support and now they don't see their friends anymore? And even between providers, because we, you know, Hope House is one of our great sister companies that are just right down the road, but a lot of their customers aren't coming to day support. But you know, it's like our customers might want to say hi to their customers again. And so we are starting that discussion on how can we use this technology to help our customer have a great experience. Okay, burning through this. Actually, I think that's almost it. So I guess our focus continues to be the safety of our staff and customers. That's utmost importance. And then giving appreciation to everybody out there at any customer-facing level. I think I'm asking all of the admins, please give the DSPs appreciation and thank them for what they're doing, because it's amazing. And then all the DSPs and sponsors out there that are having to deal with a remote admin, please understand that these admins are also under a lot of stress, even though they're not out there, you know, with a closer exposure to potential virus. Their jobs have changed. Maybe they're trying to work at home and there's kids running around and doing interruptions. And so this whole thing has been stressful on all levels of this company. So I really just ask everybody to appreciate everybody for what you're doing. Nobody has had it easy through this crisis, but I'm really, really proud of the way the team's working together right now. The communication's continuing to flow and the company's continuing to operate. Another great news that I was actually running the numbers right before I got on this call. I looked at the percentage difference from last payroll to this payroll in the number of dollars and hours, because I wanted to see that did we adapt properly to the change in our revenues, right? So we know on the call we talked about it, the revenues went down right around 13 to 15%. Primarily was day support. We also had some in-home drop. That number is kind of a fuzzy number because some people go up and down for all kinds of reasons. We're trying to really figure it out. But let's just say it's 15% down. We needed to see our W-2 based labor to go down roughly that same percent. And sure enough, it's a little higher here and a little lower there, but at the end of the day, it's about 15%. So I think what's happened, I think we hit it on the head. We properly adjusted the number of hours, both administrative and direct support. And I think we've righted the ship. So even if this SBA loan doesn't come through financially, we're going to be just fine. We're going to make it through this. It's a matter, at this point, we're not worried about the company financially and structurally. We're worried about only the safety of our staff and our customers. But don't worry about your paychecks bouncing or any kind of bankruptcy. All the stuff you're hearing in the news about other companies like restaurants and hotels and sports venues and colleges, it's not happening here. We got that part of it under control. So you guys just focus on staying healthy and safe and making sure our customers have the best lifestyle within social distancing. And that's all I've got. Andy, you want to chime in on anything?
I think you covered pretty much everything. I just wanted to bring up one more time about making sure that you have what you need to support the people that we're supporting. So, you know, I haven't heard much as far as needs go, and you may be communicating with your immediate supervisor, but if there are games or activities or TV channels or certain things that the people who are living in the homes might appreciate in order to, you know, keep themselves amused during this time, I think it's really important. Just let us know so we can make sure that you have what you need to help the people that we support have a good day. And also let us know if you're running low of anything, cleaning supplies, masks, any of those things. Please keep communicating. We want to make sure that you have everything that you need to have a successful and enjoyable day, you know. So it's I know we all get a little bit restless being at home, and for the folks that we support, that's exactly the same thing. So please just shout out and we'll be happy to give you what you need. So thank you. And again, big thank you for all of you for really keeping things running smoothly. It's amazing. You know, I thought we had been through some doozies in the past, but this one has been something, and it's truly amazing how well this team can work together and pull through. At this point, I think anything. So thank you.
Yeah, we should look at the chat box, because it's so funny, because what you guys are bringing up are the same conversations we've been having on the back end. So let's start with Karen's. I was thinking that if we have 2 people in the trainer's home and 2 people in the trainee's home, we could Zoom skills. And that's exactly the type of thinking that we were doing. Is an instructor, for example, a CPR instructor or PCT trainer, you know, they're the only ones that are certified to sign off on the skills. But if they're on the other end of a Zoom remote, and I'm talking, this could be somebody in Danville observing somebody in Virginia Beach. It doesn't have to be just Virginia Beach. But then that person could still sign off on it as long as they saw those skills get demonstrated. So that's a way, because the idea is that at any given group home, a supervisor or an ASC or, you know, an SC or whatever, they may already be in contact with the staff. So the social distancing and all of that, they're in contact. They're going to and from a house. So if they can be observed doing the skills, and that means that those DSPs or those ASCs, they don't have to come to a training room with a trainer, potentially passing an infection to other group homes or other sponsors. So that's the type of thinking that we're trying to do, is how do we use technology? We want to stay in compliance. We want the outcome to be the same. You know, we're not breaking any rules, but where can we find efficiencies? And that's definitely one that we've talked about.
And I think to add to that, even when we get to the other side of this, having a greater flexibility in training, I think is going to benefit everybody across the board. You know, generally the trainings are weekdays 10 to 2, whenever those are. And for some of you, that may not make sense. And so it may work better for you to be able to complete your training either independently through self-study or from your home, or in the evening or on an overnight shift or something like that. So I think it will increase our flexibility also.
Absolutely. Yeah, I was talking to Andy about that if now that we have the potential to train through Zoom, we could provide training during the overnight, so that people that are working an overnight shift in a group home or even an in-home situation, they could take their training during their shift. They don't have to break their normal sleep cycle and come into a classroom at the 10 o'clock time frame, when normally that's when their sleep time. So there's really some cool things that and I think what I was saying on a call the other day is that normally we're going so fast driving our car, we can't fix it while we're on the interstate. This has given us this opportunity where the car's parked on many topics, and we're able to go in there and clean it and fix it and change stuff. And of course, it's a team effort. It's not, I'm observing that we have this opportunity, but of course, it's a huge collaboration, whether it be how do we restructure training? How do we, get our customers communicating? How do we, when we look at day support, once we reopen, what's that going to look like? I mean, we're gathering information from everywhere, from everybody, and trying to make this this is a great opportunity for day support. And so all the things you hated about the old system and all the things you loved about the old system, we can look at it and say, hey, can we get rid of that, add some more of this in? And when we launch day support again, it's going to be the best thing ever. But normally day support's in operation. We can't ever park the car and fix it because it's always running at 100 miles an hour. So this is going to be fun. Stephen brought up another one, and this is one where I believe we need to figure out something like this. And so his suggestion, have a worksheet completed at the end of the Zoom training and emailed like it's homework. Give like 10 minutes in a meeting to fill it out and send it back. You could ask questions while doing it. So I think the intent is how do we get engagement, right? I think that's really what he's trying to get at. There's a couple ways to do that. Instead of email, there's a Survey Monkey is one way to do that, where people could actually be filling it out on the call. We also have Moodle. People can be on Zoom and Moodle at the same time. They literally could be taking the class and taking the test. And so at the end of the class, we can see, were you paying attention? Okay, everybody, we're about to answer question 5. And then if you weren't paying attention, you don't know the answer or whatever. So we could have real-time engagement on our Zoom calls that might even exceed the amount of engagement that we had in in-person training. Or we give rewards. It could be a thing where, you come into class and you have the potential to win money if you get 100% in the test or whatever, whether it be your hourly pay rate or whatever. But there's ways of incentivizing people to pay attention on the class and participate. And let me give you another example. I saw the other night, I was in a virtual learning environment. It's like a big video game, and they were playing a trivia game. And so you're watching these avatars move around like a video game, and questions come up on the screen. And the quicker you answer the question, the more points you get. And so the idea is that there's people from around the world playing this trivia game in the audience, and it's facilitated by basically a trainer. And you're paying attention, because even if you know the answer, but you wait too long, your points go down. So the quicker you answer the correct answer, the quicker you get your points. Obviously, that's high engagement, because if you're not paying attention, you lose points. There's ways of doing it. It's just a matter of us figuring out what do we want to adopt as a company. What makes training fun and engaging? So these are some great ideas. Let's see. Yep, most of our training is already on Moodle. A lot of it, like ethics, human rights, all of that stuff. Yep, way before COVID, we were talking about doing that. So I'm really glad that's available. Also for everybody, you can get to that on your cell phone. Doesn't have to be a PC. And so a lot of that was designed specifically to make sponsors' lives easier, so that if they're on the Eastern Shore or they live 45 minutes outside of town, they can take their class without having to drive into the admin office. A lot of sponsors have a customer that they don't necessarily have staff, or maybe it's inconvenient to have staff come in and help while they're in training. So having the training online really relieves the sponsors of that inconvenience. And so I'm really glad we've got a lot of that in place. Let me see. Are there any med-cert classes soon? Hopefully Jeannie is on the call. Not sure if she is. Med certification is a bottleneck. It is a huge bottleneck. To this date, the nurses that we currently work with are not very comfortable using Zoom to do training. So right now, the med certifications, my understanding is in person only at this point, because there is a lot of interaction, there's a lot of demonstration. It'd be hard. One is it's also out of our control, because it's not an employee of our company. These are contractors that own their own company. And if ACT Pharmacy, for example, won't use Zoom, then we're stuck. We can't use Zoom. The other thing, I think, Kendra, I believe, told me that I think the med trainer out in Danville died of a heart attack. And that really, really sucks. She was an excellent trainer. I've only heard good things about her. And so out in Danville, I know we're scrambling, trying to find out, we need another med trainer. I mean, it really stinks that she passed away. That sucks. But the company must move on. DSPs, when they come in, we say, we're going to give you a raise the minute you can drive and pass meds. But if we can't pass meds because there's no training, it's not fair to the DSP. We're holding up their professional development, their career. So we're taking that very seriously. We need med training. I don't know the answer of when the next one is. I would check with your local HR or your local trainer, and they will give you the best information possible. Believe me, we are pushing to find somebody that's willing to do it on Zoom, because I would love it if everybody in the company could take it through Zoom and not have to physically be present in any certain division. The other thing is med policy. We're scrambling to try to get that online as quick as possible so that med policy can be done, because that's another one that can hold a DSP back from getting a raise. So we want to make sure that that's available. And with Zoom, we've got a trainer here in Virginia Beach, and we've got a trainer out in Danville, as well as we're working on a trainer in Lynchburg. But with Zoom, we can do that through the cloud, and they don't have to be physically present. So we're struggling. I'd say scrambling. We're not struggling. It's very soon. We should have med policy up and running. And then like the observation med pass, we're going to look at how do we do that using technology, similar to the skills we were talking about earlier. Let's see. So sponsors are having some trouble with technical issues. Let me see. Really help. There's someone who's good with the hardware interfaces and good with explaining things to other people. Any solutions? And that's with Gene Cullison. Okay. Yes, that is something we can do. We have a software called Screencast-O-Matic. And I think that's, Karen right now, I use it to work with my virtual assistant, and it works really, really well. Karen out in Lynchburg has been using that for her sponsors, and it's been working really well. And what that is it allows you to record your screen while you're doing stuff. With Zoom, when you record your screen, anything that's Zoom related, Zoom takes out. So for example, right now, right in front of me, next to Andy's heads on the right, I've got my webinar chat box and I've got my panelists open, but on the recording, it's not gonna show up. Zoom takes that off the screen for you. If I started messing with my audio settings during a recording, Zoom's not gonna show that. Screencast-O-Matic is a software that allows you to record your screen even on a Zoom call. So literally we could go through and say, here's how you change your microphone, here's how you change your video, here's how you add a backdrop like this, a green screen. We could use Screencast-O-Matic to do that. It also, Screencast-O-Matic is also, you can't, that's cool. Can't see my phone? Now you do. That's kind of neat. Whatever, I love technology. So Screencast-O-Matic can be done on your cell phone. So for those sponsors that want to use Zoom on the cell phone or Therap on the cell phone, the Screencast-O-Matic software can record the screen and show somebody how to do something, and then you can send a link and they can watch that short little video without having to email it or download it and all of that. So, okay, we'll add that to the to-do list, is take like the top, and maybe Gene, we can get offline about this, but whatever the top 10 to 15 skills that sponsors need to have on Zoom, I'm happy to record those on Screencast-O-Matic and put those in a place where they're accessible. That's a great, this is why we do these webinars, because like that was not on my to-do list and now it is, so thank you. Whatever we can do to make your life easier. Let's see.
Bringing Stephen in to talk. He raised his hand and has a question.
Okay, awesome.
Stephen, you can unmute yourself if you choose.
I don't.
We lost you.
Myself prepared.
There you go. Still there?
And
Stephen, you're cutting in and out.
Yeah, you might have to type it in because we could hear a word here and there, but it wouldn't give us a complete sentence. So why don't we let Gene talk and we'll come back to Stephen. Maybe he can tinker with his Wi-Fi and slap it around and make it work.
Okay, so who?
Looks like Jean had her hand up.
Can you hear me now?
Yep.
Hot dog. Okay. It keeps telling me to use the space bar, and that doesn't seem to work. So I don't know. Yeah, a lot of the technical stuff that sponsors are having is they just can't even reach getting on Zoom, or they get on and they can't hear, or they get on and they can't unmute. And some of it's related to, I'm sure, the device that they're using, not so much Zoom itself. It's related to how do I turn on my microphone? How do I turn on my speakers? And of course, I'm at a loss because I drive a Mac and I ask it and it tells me what to do. So I don't know how to do that on PCs very well. I can do it on the one I'm used to at the office where I know my machine, but to help somebody else with it, I can't. I'm at a loss.
Yep.
And some of the hardware that they may have may be somewhat dated and not compatible with the newer versions of Zoom. I know that can happen. So we would want to have a conversation about that. And then it's a matter of just taking the time. I suppose if we had some training videos that just showed the basics, or we could probably find some. I'm sure Zoom has some that exist that we can share so that we would have the basic how-tos, because it really is a matter of getting in there and just doing it enough to where it becomes natural. But yeah, the question may be about what they're using for technology. It may not be, may be a little bit outdated.
Yep. I think that's probably the case.
Okay, so what would probably happen in Screencast-O-Matic, think of it a little bit like YouTube, where we have our own private space. We can open it to the public, we can put passwords on it or whatever, but in this situation, it's just Zoom, so it doesn't need to be private. And so we can add a channel that could say Zoom tutorials, and then I or somebody else, if anybody wants to step in and record videos, we can record different things, like, for example, adjusting your microphone or adjusting your video or unmuting yourself or whatever. And we can do videos for both the PC and a cell phone. We can drop those videos into that channel as a link, and then we can send that whole what do you call it? That whole folder or that whole channel to a sponsor on a link. So they literally could just click the links and watch the videos that are titled, very short. Yeah, these would be 30-second videos. And here's how you unmute. And here's how you change your microphone settings. And maybe that'll solve the problem. If it doesn't, we'll try something else. But that's a new technology that we just started using over the last 6 months, and so far it's been very helpful. Especially the success that Karen's had with the sponsors out of Lynchburg. It makes me very optimistic that I think this will solve your Zoom problem.
I also put a couple of links in the chat. One is a basic how to join a meeting, and then there's another one about audio, video, and sharing that are from Zoom. And so it looks like they've got pretty extensive how-tos. So that might be also a tool that could be used.
Yep. All right. Anybody else? Let's see. And not that we need to use the whole hour. I was just going to go and see if there's anybody that I was going to specifically call out for an update. Well, I got one. Maybe since Nicole's on the call, what information could we be sharing that you think the DSPs would most like to hear? Like, what questions do DSPs have? And maybe they're too shy to come on the call or too shy to ask. Nicole has never been one to be shy, so I'm interested to know, if there's something more we can do to share information. I don't know if that's.
And there's also Leslie had said that she has a DSP there with her too. So Leslie, I'm not sure who's with you, but they may also have a question. But I'm going to bring Nicole into the room to talk.
Hopefully she's there.
Does you have something you want to share? Hi, Nicole. You're muted, so hi. Hey, yeah.
I mean, honestly, the question on everybody's mind is, has there been any potential exposures? Like, say, a family member who might be tested or something of that nature. That's what everybody's thinking about. And
so far, we've only had one. We had one staff that tested positive in Lynchburg. And so this was our first experience of going through how do we notify people, what do we do? And so we've clearly documented the steps that we took so that we know what to do the next time. We called the hotline at the hospital. and took the advice from them on what to do for the individual. This was with an in-home situation, so there was about 4 staff that had been in and out, and the staff member hadn't worked for several days. So they gave us guidance on how to follow through, notifying the family members, notifying the staff that had had contact, notifying case managers, and also the health department. They asked us to notify them. So we followed all those steps, and fortunately, the staff member is doing better and able to return back to work next week, and there's not been any crossover to the other staff or to the individual that was being supported. So I'm knocking on wood on that one, because that turned out best case scenario, but at least now we've been through that situation and we kind of know how to navigate it. So if there was a potential exposure and you were working, you would definitely be notified. So it's that contact tracing that they keep talking about. We would be notifying you on how to proceed. So
that's interesting, contact tracing. What if, for example, a family member of a staff was tested for COVID-19? Would that be considered potential exposure to the staff and the other people that work with that person?
Right. We again, we're really taking the guidance from the 800 number. We call and we say, okay, this is our scenario. Here we are. This is what happened. What should we do to proceed? And so we're taking the guidance from the medical experts on how to proceed.
Okay.
I believe that we did have one scenario where there was a family member, and it had been over a week since they had been in contact with each other, and we called the number, and they told us that we needed to have the person monitor for symptoms and take their temperature in the morning or daily before they went to shift, and to use the mask when they were providing contact within 6 feet. So again, we're really leaving the guidance on how to do with the scenario to the medical folk, and we just keep calling and saying, okay, this is what's going on. How should we proceed? So
I mean, yeah, I get that. So that person's temperature never rose to a concerning level? That would see, because that's the kind of thing that people want to hear, like to kind of calm their nerves.
Yeah, absolutely. And we encourage everybody to be, we're monitoring the individuals we support for symptoms, but we also encourage self-monitoring, taking your temperature at least once a day, paying close attention to any symptoms that you might be experiencing. And, when you have questions, the hospitals have been, the 800 numbers that we've called both here and in Lynchburg have been really helpful. I think they're getting a lot of calls like that from people who are nervous and really not sure how to proceed. So there's numbers available for Centera, and also I think it's Centra, which is out in Lynchburg.
Okay.
The other thing just to remember, it is a little scary about that 25% of people could have it and have zero symptoms. Mm-hmm. A lot of, as these people come off cruise ships, and it's like large percentage have it and they had no idea, no dry cough, no fever, no nothing. So this is a little bit like universal precaution. So no matter if you feel healthy or you see somebody else that looks healthy, still do the social distancing as if they have it. And again, that's why you cover your nose and mouth, because even if you're completely healthy, all it takes is to say a word wrong, a little spit droplet flies out, and and then now it could be spreading. So, but yeah, so we can monitor temperature. We can monitor if somebody has a dry cough, of course, like stay home, like we'll get you the leave, the COVID-19 leave or whatever. But we still got to remember that 25% of people have no symptoms. So let's just assume everybody's got it and do the best you can to do social distancing.
And the really good thing is that it appears that our DSPs have been really forthcoming about potential exposures. And so, there's been a few where it's been like, well, my roommate's friends works at a place where they interacted with somebody and it was like 4 generations of removal. But I appreciate people letting us know when there is a concern, so that we can, really do due diligence to make sure that we're keeping everybody as safe as possible.
So one other thing that I guess we should bring up is that both in Virginia Beach and in Lynchburg, we really need a lot more staff. We offered all the hours to people that were working day support. Once day support shut down, we offered them hours to come work residential. Some people did and some people didn't. But we need to hire a lot of people in both divisions. And we could use everyone's help in that. We have the little referral reward. Tell your friends if you have anybody that worked in retail or hotels or bartenders or waitresses, waiters. I mean, we have jobs. We can hire people right now. We're going to try to get them to full-time as soon as we can. Almost all of our trainings, virtual, online, and free and paid. This is a great opportunity to recruit people into our field, because in a situation where somebody has had potential exposure, I don't want to be desperate and ask them to come to work because we need people to work the shift, right? I'd rather say, if you want to take a couple of days off, take a couple of days off. We've got it under control. But we got to get to a proper staffing level. And right now we don't have that. So so we could use everybody's help. Every DSP, invite your friends to come to the next training. Michelle and I are working on trying to do videos on our website that take you through, like, what's the day in the life of a DSP? What's the path to leadership look like? What's our training? What are next steps? We want to make as much remote content as possible so people can consume that and learn about the company. But now's the time. People are unemployed. Another 5.2 million filed for unemployment last week, and we're approaching 20 million or something like that unemployed. It's unbelievable. So there's a lot of people out there that are suffering. Even though the unemployment benefits have been expanded, I think most of us feel value in working. We want to make a difference in somebody's life with a disability. I've got to believe that there's some people out there that have been unemployed. Maybe they are on unemployment. They want to get back in the workforce. They don't want to sit at home getting free checks from the government watching Netflix all day. And I think also, when 9/11 occurred and the airplanes hit the building and that sucked, a lot of people joined the military at that time. They wanted to make a difference. They saw that we've got this big problem, and they joined, and they were proud of that. They were proud to be an American and to make a difference. And I think this is a good opportunity. This is a huge crisis in the medical field. We have doctors out there, we have nurses, we have all this medical staff, but they are running short. We need more people to step up and join the medical field. We're a medical field. We are essential workers. We're providing care that must be done regardless of the chance of COVID or whatever. So please, if everybody will talk to your friends, put it on your Facebook page. We're hiring. Come into our field, make a difference in somebody's life. It is so much better than just ringing a register at a grocery store. I mean, that's a valuable job. But when we go to bed at night and we help somebody with autism, Down syndrome, cerebral palsy have an amazing life, it's a little different feeling than when you just sold a lot to look at, So please invite your friends to our field. We would love to hire as many as possible. Let's see, who else? So Stephen, I know you said you're walking to the end of your driveway and lost your internet connection. So are you back in the house where you want to chime in? Because I loved your ideas earlier on the training. I'm not sure if you're available. Let's see. Jen had sent me something in the email. I think it was something about the PPE.
Stephen, do you have a connection again? I just had you join.
I do. I caught the tail end of what you were saying about Zoom as I was, coming back and got my connection back. You guys already covered it. You took the words out of my mouth, but thank you.
Thanks, Stephen. Thanks for joining us today.
Yeah, keep the ideas flowing.
Excellent information. I didn't know anything about how Virginia was behind the curve, which is good to know. I really appreciate it. Thank you.
Yep.
Thanks, Stephen.
And I can put the link in the chat box if any of you guys want to go to that website where that information is. You can get to it. Jen before the call had said that she's having mask extenders made. I guess some of the masks maybe are too tight or they pull on your ears or whatever. So she's having mask extenders made. So that's I think it's one of our staff or somebody's making already. It's a friend of hers, but SSVA is donating some money to get these extenders made. So, so if anybody needs a mask extender, Jennifer Anshley is your go-to person to pass those out. So thank you for that, Jen. Okay. I was just trying to see if there's anything in the email. I think we have all the questions. Quit putting your fingers in Steven's mouth. What is that all? Gene Cullison. Funny. Okay. Oh, they're ear savers. I see. Oh, I guess it must pull on your ears or something. Got it. So yeah, we have had some unique people making masks of different ways. Does it go around your head, or does it hook on your ears, or whatever? So thank you for your creativity and trying to solve the problem of having reusable masks. Please, one more time, do not try to get N95 masks. Please do let the hospital workers have those. They're not necessary in our environment, but other mouth coverings, especially ones that are reusable, are highly recommended. So. Oh, and another one from Karen. Raspberry Hill is working on a virtual 32-hour class. That's the med certification class. They're about a month away and have some people, let's see, has some people come in just to demonstrate the skills. So that's hopeful, yes. So Karen, thank you for that contact. Whatever you can do to help expedite that, make sure we're first in line when they want to go live. I'm happy to let them use our webinar account or facilitate the Zoom call, but that is one of our biggest bottlenecks. As med cert and med policy. So please, everybody work together to see how can we get that solved as quickly as possible. So
I just had Jennifer join. She had her hand raised.
all right.
Just about the ear savers, I thought they might work as mask extenders, but I tried it and it doesn't. But when you have to wear a mask every day, your ears, the backs of your ears can break down. So I did find a guy on Facebook. He was kind of making them for free, but appreciated donations just for supplies. So I was able to get 50 of them. So obviously it's going to be a kind of first come, first serve thing. And at the latest, they'll be in the office by Thursday. So if you do need one, then you can contact either Patsy, Maria, or myself.
Thank you.
Yeah, I can see how normally we don't have things touching our ears, and now all of a sudden you got it on there 8 or 9, 10 hours a day. Yeah, I can see how that would break down. Yep. All right, I think we don't have any more questions. It's 11:53, so we're within the hour. That's good. All right, guys. Well, thank you for being on the call. Thank you so much for the questions and participation. This really helps us do the best we can to make your life as easy as possible so that you can get out there and help the customers. For the sponsors out there, we didn't have a lot of sponsored activity today, but thank you for attending, and keep your ear to the ground on questions that sponsors may have. We're happy to answer these questions, and I guess we will see you next Friday. For anybody who was not able to attend this webinar, we're going to have the link in the I think last time I put it on YouTube and then shared it. Andy, do you have a place where?
Yeah, I shared it through SCOM. So everybody got a link in their SCOM.
Gotcha. And then before we end, if you're interested, like Stephen, if you're interested in looking at the same charts I was showing on the screen, I just put the link in the show notes to all panelists. So do a quick copy and paste before we get off the call, and you can copy that over. So, all right, everybody, I really appreciate your attending, and we will see you next Friday.
Thank you.